Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Question. A non-diabetic mellitus lady is presented with left meningioma and she is planned for surgery. And on the surgery, a JR made a mistake and made a mistake while writing pre-operative notes. And what is the mistake that the JR did? So she has a left meningioma. And one thing, if there is left meningioma, she must have been on steroids. If the patient is on steroids for longer time, we should give pre-operative steroids, especially if the patient is on steroids at a dosage of more than 5 milligrams for more than 3 weeks, then we should give pre-operative steroids. But the JR wrote that stop steroids. So if the JR wrote stop steroids, then this is wrong because we should give pre-operative steroids in this patient.
thank you and thank you for watching.